With cold and flu season quickly approaching, you might want to get ahead on scheduling those vaccines, but you could hit a roadblock if you want a COVID shot. From new CDC guidelines to an executive order from Josh Stein amending those recommendations, knowing where we stand can be confusing. So WFMY News 2's Giselle Thomas talked with an official at Cohen about the qualifications you need to get vaccinated without a doctor's note. Giselle?
Yes, so coming up soon, the CDC has an advisory committee that's actually having a meeting this week to talk about some guidance when it comes to children. Right now, that is up in the air, so let's talk about what we know now. Now, following up with Governor Josh Stein executive order that went into effect last week, it makes it so that if you are over the age of 18, you can get a vaccine without a prescription, but only if you are at risk for severe disease. Now, I spoke to a healthcare expert at Cone Health, Cynthia Snyder. She tells me that if you have depression, obesity, or if you smoke, this all counts. Now, she clarifies that if you are not at risk, you do have to have a prescription from a doctor. She says that updated vaccines matter because each year the virus changes. This year, she says it's a mutation of the Omicron variant. Snyder shares some symptoms that patients may experience.
Some of the features that we've noticed patients reporting is that it does give you like kind of more upper respiratory symptoms like headache, nasal congestion, and pretty severe like sore throat. And I think if somebody has not had COVID or it's been a long time since they've had a COVID illness, that it can be pretty debilitating.
Now, Snyder tells me that respiratory illness season is expected to start up in early October. And she says it's not just COVID-19 that people should be worried about. This also includes flu and RSV. Live in Greensboro, Giselle Thomas, WFMY News 2.